Hello, welcome to another edition of Health with Patricia, where we have honest conversations about issues affecting your health and well-being. And it's still time with your gynae. Today we're discussing cervical cancer. It is preventable, but yet it claims thousands of lives each year. And we want to understand. And Dr. Promise Sehoga, a consultant obstetrician gynecologist at Shape Healthcare Specialist Medical Center, to help us understand what are the causes, like how do you even detect it when it's starting, like the early stages? Is it something that can be treated immediately? Is it something that is recurrent? Or yes, we want to understand it all, and it's still time with your gynae. Doc,
Yeah.
cervical cancer.
Yeah.
Yeah.
Cervical cancer.
Please help us understand.
It is the second leading cause of cancers in women after breast cancer. And unfortunately, about 80% of the cervical cancer cases present in the advanced stages.
Okay.
And that is sad because when a cancer is advanced, there's very little we can do because then there's only left with palliation. If you have pain, we give you pain medicine. If your blood level is low, we give you blood medicine or blood just to make life comfortable for you for your smooth passage. There's very little we can do. Meanwhile, it's a cancer which is caused in this part of the world. Majority of it, 99%, is caused by a virus which we call the human papilloma virus,
Okay.
HPV. Now, we're told that up to 70% of sexually active individuals have this enzyme,
Okay.
this virus. Okay. Now, this virus is sexually transmitted. It is the commonest sexually transmitted virus, the human papilloma virus. That virus gets into the body and it hides in the cervix. This part, this is the womb.
Okay.
This is the ovary where the woman's eggs come from. This is the tubes where the eggs pass through to get fertilized. One on the left, one on the right. And this part of the womb is what we call the cervix. And so during sexual intimacy, that virus goes to catch here. And it can be there at the cervix for 10 to 20 years without causing any symptoms. A lot of the time, if your immunity is strong enough, you're able to fight it off, clear the infection. But in those whose immunity is low, then this virus hides there for this number of years, causing the cancer gradually underground without giving you any symptoms, which is why screening is very important. Because when you do the screening, then we're able to detect that, hey, there's something going on here.
Okay.
Then that's what we say early detection.
Okay, sure.
Okay. Now, those who are at risk of cervical cancer are those who practice high risk sexual behavior, like having multiple sexual partners and having unprotected sex, casual sex, or you have a partner who has multiple sexual partners, or a partner who has had multiple sexual partners. Okay. If you don't do your screening regularly, you've heard of us talk about pap smear.
Yeah.
A very simple test. We just use a tiny brush to just brush over the cervix and remove the cells and send it to the lab. And that tells us every information that, hey, there is HPV infection or there are changes that could be potentially cancerous. A simple 5, 10, 15-minute procedure, potentially life-saving when done regularly, either once every 2 years. Okay. Or if we think the risk is higher, we do yearly. Then the other risk factor is if you fail to take the vaccine. Now there is vaccination that can protect against that virus. Okay. In the developed countries, they've been able to kill off or fight off cervical cancer through regular institutionalized screening and then the vaccination. Now, like we said, for the whole period that the cancer is cooking, it doesn't give you any warning.
Yeah.
By the time you begin to see symptoms, it's already late. Now, the commonest symptom is abnormal bleeding.
Okay.
That can take the form of your menses becoming heavier than normal or staying longer than normal. Or you have your period and you're expecting the next one here, then you're bleeding in between.
Okay.
Okay, what we call intermenstrual bleeding. Or sometimes during sexual intimacy, when the male organ touches the cervix, it makes you bleed. Bleeding during or after sexual intimacy could be a warning that there is cervical cancer. Or sometimes the woman is washing down and she pokes her own finger to clean and touches the cervix and she sees bleeding. Right?
Yeah.
Those are the common warning signs. I mean, common symptoms of cervical
Cervical
cancer.
cancer. Okay.
Sometimes there is this very offensive vaginal discharge, extremely offensive, that could show that. That is why we're saying that when a woman gets an abnormal vaginal discharge, shouldn't take it for granted and just go buy medication and take or insert,
It could
because
be.
you don't know what we're dealing with,
Okay, sure.
right? When the cancer advances, then it spreads to the other organ. It can spread to affect the rest of the womb. It can spread to the bladder where the urine comes from, or to the rectum. It can spread to the liver, then we are in trouble. The cancer makes your blood level to drop, then that is getting late stage. When you have anemia, you don't feel like eating, it spreads to your bones, you're weak, then we are nearly losing you. The painful part is that this cancer can be prevented. Okay, how do we prevent it? We say people to avoid high-risk sexual behavior. If somebody has any other form of sexually transmitted infection,
Yeah.
it means that most likely they have been exposed to the HPV as well, the human papilloma virus.
Would it be right or would it be correct to say that it's a virus that or something that the men carry?
No. We say that that virus is sexually transmitted.
Yeah.
So if you take 10 men and women who are sexually active,
Yeah.
7 of them carry it, men and women.
Okay, sure.
Right. Okay. And that is how it is carried and sustained and passed around. So cervical cancer to a large extent is sexually transmitted. So if somebody has hepatitis, gonorrhea, syphilis, then it is likely that they've also been exposed to that virus, the human papilloma virus, which causes cervical cancer.
Okay.
Okay. Sometimes the virus, that HPV, has so many different subtypes.
Okay.
Some types cause some rashes on the vagina that you see outside, or the vulva,
Okay.
or in the men on the penis, which we call genital warts.
Okay.
So if you see that, it means that person has been exposed to some types of this virus. So that person needs to be followed up closely.
Okay.
So avoid high-risk sexual behavior. The things that need to do to boost your immunity. Somebody who has HIV, their immunity is low, so their risk is higher. Somebody who has diabetes, that is
The
not
immunity
well
is also
controlled, the
high.
immunity is low, so the risk is higher.
Okay, the risk is high.
Okay.
So, okay, sure. So when somebody comes to the hospital, you check, like do a pap smear, and then you check and you realize that I think there's something going on there. Not first year the test is positive, second year the test is positive. Is it likely that the person might end up maybe later on in the year with cervical cancer?
We don't even wait for it to get there.
Okay, sure.
The whole point of the screening is that because the early stages wouldn't give any warning sign, we are proactively searching. Is there anything that is likely to give us a pointer?
Okay.
So if you see that there is something showing that some area of your cervix is affected in the early stages, we remove that part of the cervix, and that does it.
Oh, okay.
Okay?
Yeah.
Yes. If we check and everything is okay, then we say, hey, you'll be advisable to take your vaccine. Because the game changer is the HPV vaccination. Like I said, that's what the developed countries have used to fight off cervical cancer. Recently, you heard that there was a national campaign for young girls between 9 to 14 years. Yes. That is extremely important because the vaccine works most effectively when it is given before the girls become sexually active. But every other adult above age 25 should take their pap smear regularly. Now, even though the vaccines work best before the girls become sexually active, adults who are already sexually active still do benefit when they take the vaccine compared to not taking it at all.
Is it possible to maybe take out the whole uterus or
Yes, so
to
when it
prevent it
is
from spreading
detected,
further?
yeah, when it is detected, cancer comes in stages.
Okay.
We have stage 1, stage 2, stage 3, stage 4. If it's detected at stage 1, we do surgery, just remove the uterus and the cervix, and maybe the person will go through chemotherapy or some form of radiation later on. Stage 2 and above is already bad business.
So
The
we
surgery may
just
not
prepare
help.
the person to...
Some we just have to do the radiation to see if we can slow down the progression, but not be able to remove it entirely.
Doc, your final words.
Cervical cancer in Ghana, every year we detect about 3,000 new cases. Every year. Women, 1, 2, 3, 4, 3,000. And increasingly we are seeing it in younger women from in their 30s. So, regular pap smear screening, vaccination, these are key for early detection, prevention, so that we can prevent death from cervical cancer.
How wide has this education gone?
As wide as you can tell. A lot of people don't know about it.
Because it looks like every year the number is increasing. Every year the number is
So we
increasing.
have to keep creating awareness and pointing people on the right thing to do.
Sure. Thank you very much, Doc.
That's
Dr. Promise Sapoga. He's a consultant obstetrician gynecologist with Shape Healthcare Specialist Medical Center here at Latibio Koshi. As I said, his team is always available and ready, whatever be your gynecological problem. They do not just deal with gynecological problems. They have the urology department also here, the pediatrics department, the nutrition, the ophthalmology. As a whole unit on its own. So please, just in case, whatever be your situation, please locate Shape Healthcare and Medical Specialist Center at Latibio Koshi. Dr. Sepuga is always available with his team to support you. Until same time next week, please stay blessed.